All right, guys, we're gonna do a lip injection. You guys have seen me do lip injections for 20 years. I've been a little lazy not making lots of videos, but I figured, you know what, let's use the opportunity to show you some of the innovations in technique. You guys have seen a lot of trends and fads and hype on Instagram, but I want to show you what really works, what's safe. And one of my favorite products for lips is Restylane Kysse. There's other products as well, but I love Restylane Kysse. You've heard about migration. Migration is complete nonsense. Fillers do not migrate. If you overfill the lips, the filler goes from here and spills over. So you lose the border and basically it looks fuller above it. So there is no migration. The filler from here is not ending up over here. That doesn't happen. So I need injectors to stop saying that, but it's basically a spillover effect and we don't want that to happen. So where you put the filler, when you inject the filler is important. Where you're directing the needle is important, but also understanding there's limitations. If you take somebody whose lip capacity is overfilled, then what ends up happening is that filler has got nowhere else to go. It's just going to spill over to the surrounding structures. And when it comes to lips, the vermilion border needs to be sharp, needs to be crisp. And if somebody wants giant lips and they don't have enough capacity to stretch out their red lip, which is this area, what ends up happening is that the lip starts to look full above it and it looks like it has migrated, but it has not migrated because there is no such thing. So we're doing border. And we're going to do red lip itself as well to keep it nice and sharp. Now again, open your lips please, leave it open. If you go ahead and overfill it, remember this lip is not a flat structure. This is not a two-dimensional structure. When you put lipstick, it's two-dimensional, it's flat. But when you put a filler, it's going to come out this way and it's going to go up this way. So this entire place that I'm holding in my fingers fills up. And guess what happens? Then when you get this fullness in the white lip, it looks like it's migrated. So I need all of the nurse injectors, dermatologists, and people out there using the word migration to stop doing that, please, and educate people properly into spillover effect. We don't want spillover. So again, the needle's going at the proper angle. You can see where the needle tip is ending up. It's away from the white lip. We go back to the border. The border is something that some people have very crisply and some people don't have it. You can create more definition at the border. You can see somebody who's got lots of lines in their lips. Those lips are more stretchable. If somebody has more wrinkles and lines in their lips, you can make their lips dramatically bigger because it has room. It'll stretch. But if you don't have those, and some people come in, especially Caucasian young white patients, have very smooth, thin lips, there is no room. There is no room for that lip to stretch. So what ends up happening is if you're trying to make it 50%, 60%, even 30% bigger, you can't do it all in one shot. It has to be done in a multiple series to do what's essentially a tissue expander. You're slowly expanding the lips. And those people are much higher risk of this migration effect or spillover. So the bottom lips have two tubercles, right and left tubercle. So the injections to the bottom lips is very different. You're trying to basically enhance those tubercles. And I've seen some patients on social media, they get these tooth dental flosses put or strings placed between their lips. It's very gimmicky because guess what happens? Afterwards, when you take that string out, the filler can blend and migrate and move between those. Now in that situation, it is migration, but it's not migrating to somewhere else. It's basically sliding over. So if you use a straw, if you sit there massaging your lips, if you start, you'll see some of the filler will move over. It's here and it can slide over across this, but it's not going to go into a whole different area. There is a plane where you can see me as I put the needle here. The filler kind of will fill and go across as well. And I'm actually counting on that so I can poke her less. It's fewer injections. You can see the top lip requires more injections The bottom lip requires less injections. Now, you've seen these ultrasonic devices, people trying to map out where blood vessels are. Well, blood vessels are tortuous. You may see it at the surface, but they still will snake and be tortuous as they go across. So they're not that helpful. You've seen people create, every time they poke it in, their retrograde pull back. It's not necessary if you're actually using technique that's proper. So never high pressure injections, never stay in one place and just inject high pressure. It's very low pressure and you're slightly moving it. So you're never in the same blood vessel for more than a nanosecond. So as I'm putting it in, I am pushing it in. So the filler is actually pushing blood vessels out of the way and I'm injecting it going forward, going backward. So it's never staying in the same place more than a few nanoseconds. And that way you're not gonna get vascular occlusion. Lips open. Now here's a technique that you've seen plenty of on social media, this direction. And this can definitely help tenting the upper lip, creating more of a upper lip show. Now this patient eats a ton of nuts and seeds and omega-3s and seaweed, so she is going to bleed more. She is going to bruise more. We have a whole list of foods and supplements that you should be avoiding about 2 weeks before any injections. All of the healthy Mediterranean fats, omega-3s, should be avoided because that'll create more bruising and more bleeding. Relax your mouth. Cool. Same thing in this direction. These are minor. I mean, you see me injecting a million times and the plunger barely moves. So this is true micro injections. This is true nano injections. I mean, barely anything is being put. All the injection that I did, it's not even half a syringe yet. Because what I don't want to do is put too much in one spot and then have to rub and massage and massage and massage it away. I want to make sure that micro droplets are placed in the right place. All right, smile for me, really big. Blow a whistle. Good, I'm checking for symmetry. So I'm gonna sit her up and you can actually see the symmetry of the lips. And you can see how she has the proper outline. She has the proper definition to the vermilion border. The central tubercle is fuller on the top. The lateral tubercles are fuller on the bottom. And there's perfect symmetry right there. So that is proper lip injections. Smile a little bit. She's numb, obviously. So it's a little bit weird, but that's gonna wear off. There's no lumps, there's no bumps. Cool, chin up a little bit. Perfect.